Hi folks, today we are going to learn about space maintenance. Now, premature loss of primary teeth is very unfortunate. It is mainly due to lack of knowledge regarding oral hygiene procedures and maintenance of dental health. So, whenever there is a premature loss of primary teeth, we should go for a space maintainer. Now, moving on to what are the space maintainers. Now, space maintainers is a fixed or removable appliance designed to preserve a space created by premature loss of primary teeth or a group of teeth. Now, if anybody asks you what is a best space maintainer, then a primary teeth with a proper mesodistal width is considered to be the best space maintainers, and that is why we do a lot of procedures to save a primary teeth until permanent teeth come into eruption. Now in this picture you can see that when there is a loss of one primary teeth, the adjacent teeth tries to move mesially, blocking the permanent teeth to move into eruption. For example, the 6 has tilted in the space of 5. Now the second premolar is trapped. In such condition, when you place a space maintainer, the 6 remains at its own place, allowing the second premolar to erupt into the occlusion. There are a lot of space maintainers, but what are the requirements? It should maintain the entire mesodistal space created by a lost tooth. It must restore the function as far as possible. It should be simple in construction and strong enough to withstand the functional forces. It should not exert any excessive stress on adjoining tooth, permit maintenance of oral hygiene, and should not restrict any normal growth and development, and it should not come in any other functions of the teeth. Once we have decided what type of space maintainer we are using, we should see the timeline, means how much time has elapsed since the loss of the tooth. The dental age should be considered rather than the chronological age, because there is a lot of variation in eruption of the tooth. Then how much amount of bone is covering over the unerupted tooth. Then what is the sequence? Whenever a space maintainer is planned, adequate consideration should be given to the adjacent developing and erupting tooth. And lastly, congenital absence of any permanent teeth. Now moving on to the classification. According to Hitchcock, it is divided into removable or fixed, functional or non-functional, bands, without bands, and active or passive. Now moving on to the advantage and disadvantage of fixed space maintenance. Now, advantage means it requires minimum or no tooth preparation, does not interfere with passive eruption, jaw growth is not hampered, and it can be used in uncooperative patients. Disadvantages is it can lead to decalcification of the tooth, which is under the bands, and elaborate instrumentation is to be needed. Step of fabrication, it's a kind of band formation. Then we need to properly build it, take the impression, cast, loop fabrication, soldering, polishing, and cementing of this banding. We had already discussed in our first lecture how to do banding. Moving on to band and loop space maintainer. Now, band and loop space maintainer is unilateral, non-functional, passive, and fixed. Any space maintainer you can divide it into 4 if it is unilateral, non-functional, passive, and fixed, and it is used if any single tooth is lost. Now moving on to lingual arch. Lingual arch space maintainer is again bilateral, non-functional, it can be active or passive, and it is a fixed in mandibular region, and it helps in effective space maintenance. Now is a Nance palatal arch. It is again bilateral, non-functional, passive, and maxillary fixed appliance. It has an acrylic button in the palatal tissue which provides resistance to the anterior movement of posterior. Means if the posterior teeth will try to move forward, this button will resist that movement. Next is a transpalatal arch, unilateral or bilateral, non-functional, active or passive, and maxillary fixed appliance. The one space maintainer we need to discuss is about distal shoe space maintainer. It is also called as intraalveolar appliance. It has two modifications, Willets and Roches. Now there are some criteria. There has to be the width. Adequate width is not provided, but we need to take a intraoral radiograph to see that it is not hindering the eruption process of the permanent teeth, and the gingival extension should be 1 mm below the marginal ridge so as to capture the medial marginal ridge of the teeth. Moving on to the removable space maintenance. It can be of aesthetic types or using of a acrylic dentures, which can be functional also. If we are placing a teeth like a RPD, it will also help in mastication process. So those can be unilateral or bilateral, but they can be functional in nature. They should be passive in nature and should not apply any kind of force to the adjacent teeth. Following this is a chart that if any teeth is missing, what are the suggested treatments and reason. You can take a screenshot. I have included all the teeth which is there, and I give this credit to Google because I have taken that table from the Google. If you like my contents, please like, share, subscribe and comment below what all topics you want for me to cover for you. Thank you.